Sure, so AF is the commonest arrhythmia that anyone suffers from, and there's a 1 in 4 risk that any of us will develop atrial fibrillation in our lifetime. It is a disease of the ageing heart, so you're more likely to develop it as you get older. But instead of a regular heart rhythm, we get an irregular heart rhythm, which means that clot and thrombus collects in the left atrium, which is one of the chambers of the heart, and when that happens, there's a risk of tiny blood clots being thrown through the circulation, and if they head up towards the brain into the middle cerebral artery that supplies the main hemispheres of the brain, it's very possible that these big clots can block off areas of blood supply and cause stroke, and that's called an ischemic stroke or an AF stroke. And the problem with those is because they are what we call cardioembolic, so cardio coming from the heart and embolic, that they embolize up to the brain, that they are often really major strokes, so result in people having loss of power, so hemiparesis, loss of sensation, loss of speech, loss of swallow, loss of control of bladder, so often leaving people extremely disabled. The thing to be aware about atrial fibrillation, however, is sometimes it's what we call paroxysmal, so it comes and goes. So just because you don't have atrial fibrillation all the time doesn't mean you're not at risk. So when you come in and out of atrial fibrillation, your risk is just as high as if you're staying in atrial fibrillation. So I would just say that if people are having palpitations or the awareness of an irregular heartbeat, but on a one-off check the pulse is regular, it doesn't mean that they don't need more investigations. It means they might need to see their GP or their hospital specialist for a longer period of heart monitoring. We've got vitamin K antagonists, so we've got warfarin, and also we've got another drug group called the DOACs, the direct oral anticoagulants, that are very effective in treating atrial fibrillation. So we need to make sure that not only we're detecting, but also we're protecting people by giving them the right drugs. And then we're perfecting, so we need to make sure that people take the medication. We know that 1 in 3 people, when they're given medication when they leave hospital, they stop taking it within 3 months. So there's no point having a tablet if it stays in your kitchen cupboard. So it's about adherence and persistence with medication to make sure that people get benefit, and regular monitoring.